previously have pushed them to feel like, hey, I gotta look like Kim K, I gotta have her butt, even though I'm a twig.
Don't say that.
But that's what happens. That's what it is, and that's why our kids are so f***ed up.
I know, yeah.
Hi, I'm Dr. Joubin Gabbay. I'm a board-certified plastic surgeon here in Beverly Hills. Today, we're going to talk about the big plastic surgery trends to expect in 2020. We're going to talk about what's going to change and what's going to stay the same. I would love to start by hearing your favorite plastic surgery trends of 2019. Put them down in the comments below and let's see what changes. What is body contouring? Body contouring is a combination of any number of procedures that will shape your body the way you want. Add a little here, take off a little there. The problem is, in the old days, you kind of got what you got, and sometimes you got a little too much or not enough. Today, I'm seeing a lot more customization. I'm seeing a lot more body contouring that fits your body. Over the last decade, everything has been big. Big butts, big boobs, bold everything. This follows our world of social media glam, fast fashion, and everything out there for you to see. I really think that's all gonna start calming down. I say this because I've already seen it happen. Things are getting more subtle. Things are getting more refined. Things are getting more delicate. And there are a lot of really good reasons for it. The way our world has changed in social media over the last several years is that today, my patients are able to use hashtags, search functions, all that stuff to go and find boob jobs, butt augmentation, liposuction, whatever, on people that look more like them. People who are similar to their bodies. It's not just seeing the same operation on the same 6 people that are there everywhere in front of your face like it was in, let's say, 2006. Look, not everyone looks like Kim K. Not everyone looks like some huge celebrity, but now you can find that one person who looks a lot like you and who gets work done that is similar to what you want to have done. It's amazing. As we're going into 2020, I've been seeing a lot more awake plastic surgery procedures being performed. These are procedures where my patients are super comfortable, super relaxed, but because we're able to use local anesthesia in a smart and effective way, we're able to do some pretty dramatic procedures on them without them needing general anesthesia. Who doesn't want that? A big reason why I'm seeing a lot of these awake procedures done is just the choice of my patients. Look, a lot of them don't want a big operation that requires an anesthesiologist, a lot of downtime, a lot of this, a lot of that. If they can get something done safely and effectively while they're awake and comfortable, well, why not? Another big push towards the awake procedures is that just inherently, they're less traumatic. When someone's awake, you gotta be careful. You gotta be gentle. And because of that, the procedures give less trauma to the body, and that means a faster, easier, and better recovery. So skin tightening. Why? What's the deal? There's a lot of loose skin out there in the world. There are people who age, skin drops. There are people who gain and then lose weight, skin drops. Listen, just normal life, people have loose skin and a lot of people want to deal with it. So traditionally, the best way to do it was just like hemming some pants or doing some sewing stuff. You cut out loose skin, you pull the rest of the skin together, you make it tight. Well, that's kind of invasive, isn't it, guys? Yeah, it is. There have been and continue to be a lot of non-invasive or non-cutting types of technologies that work directly on the skin to shrink it down and make it literally shrink wrap your body. So the general idea now is that we're using something that goes under the skin, over the skin, into the skin to deliver some sort of energy to the skin and make it shrink. One of my favorites is called Renuvion or J-Plasma. These things will go underneath the skin. They somehow transfer that radio frequency energy directly to the skin fibers and not only cause them to immediately shrink down, but in this crazy way, they actually stimulate the body to create collagen, to create inflammation, and continue to shrink the skin down over time. Carrying on from that trend of less is more that we were just talking about in the body, up in the face, we're seeing less of that big and bloated look you saw all over social media around 2015 to 2017. I think the procedure that sort of most embodies this is the buccal fat reduction. I'm seeing a lot more of it. I'm doing a lot more of it. Buccal fat reduction is a procedure where you take a little bit of fat from a little incision inside the cheek to subtly refine down the face, give a little accentuation to the cheekbone, a little curve there. It's nothing crazy, it's nothing big, but it can make a very significant change in whoever gets it. Thanks to a lot of the makeovers we've seen in the last couple of years, there are some great examples of the types of changes you can get with a buccal fat reduction. I think Bella Hadid actually is the best example of that, where you can see in that transition from her late teens to her early 20s, there's been a refinement of her face. Nothing crazy, but just a subtle shallowing of the cheek underneath her cheekbone to give a little bit more shape, a little bit more contour. Wait, sorry, my bad. Bella Hadid strongly admits she's never had plastic surgery before. All of those changes she's had are just the result of natural transition from teen to 20s. My bad, Bella, I'm sorry. You're totally right. All of those changes are totally natural. Sure. So buccal fat reduction really is the embodiment of a lot of these procedures and trends we're seeing as we're going into 2020. It's subtle, it's powerful, it makes you who you are, just a little refined. All right, so as we're going into 2020, the trend is subtle, refined, and delicate. But remember, the big stuff is still there. People are still getting big boobs. People are still getting big butts. I actually think the most exciting thing about where plastic surgery is going in this decade is somewhere that is customized just to you, just to your wants, just to your desires, and also to what is right and appropriate for your body. Let me know in the comments, are you team refined or are you team big? It's an exciting conversation. I want to hear what you have to say. As always, please feel free to like this video, subscribe to my channel, and I look forward to talking to you in the next video.